Hello, this is Dr. Gay from First Look MRI, and this is an 18-year-old female who sprained her ankle, and she has a classic findings of a lateral ankle sprain, but a couple other findings as well. So here we go. This is a view of axial T1 weighted sequence. We see that this is the lateral side of the fibula. This is where she has her lateral sprain, but she also has a medial sprain here. This is the deltoid ligament complex, really gray and thick. We see the posterior tibial tendon, flexor digitorum, flexor hallucis. They all look great, but they're elevated by this big area of gray signal. This is a thickened, sprained deltoid ligament complex with scar tissue formation. Now, if we look at the real finding here on the lateral side, we see the tip of the fibula here. The anterior talofibular ligament should be in here. Instead, we see gray signal. We don't really see the anterior talofibular ligament, so it's torn, either high-grade partial or complete tear, the anterior talofibular ligament. Just a classic findings of a lateral ankle sprain. And when that's torn, almost always we'll see a tear of the calcaneofibular ligament. The calcaneofibular ligament will come from over here on the calcaneus. You'll see a little thin band. It comes forward and it wraps underneath the peroneus, longus and brevis tendons here. It'll go up, up, up to the tip of the fibula. But in this patient, we see this gray glob, which is partly some scar tissue and thickening of that torn calcaneofibular ligament. Maybe this is part of it making a turn here, but way too thick. So this is scarred and torn. And so this would be a classic lateral ankle sprain, except for they have one additional interesting finding, and that's why I'm doing the video, is I believe they have an accessory tendon. We have the peroneus longus and brevis tendons. Here's the brevis in front, longus in back, two tendons. If we go down, hard to separate from each other there. But if we go on this cut here, we see there's a little round muscle belly. If the muscle comes down and it blends with these, we can say, oh, this is maybe a low-lying muscle belly. But if we see a little tendon coming off the bottom of it, then it's an accessory peroneus quartus muscle. And then here's the muscle. And if we go down one more cut, there's that little central tendon. So there's three tendons out there. This is a very common anatomic variant. And in this case, or which makes this case interesting, is that little tendon looks like it's torn. There it is. Let me zoom this on up here. And here we go. Zoom. We're going to go down one more cut. There it is again. One more cut. Gone. And the marker just happens to be over that. So I think they have an accessory peroneus quartus tendon that's ruptured along with this calcaneofibular ligament rupture here. And that's where they're having their symptoms. We can see that on this view as well. This is a PD fat sat, and here we go. There we get the muscle belly. One more cut down. There's the tendon. There's the tendon. Gone. And this big gray glob. So lateral ankle sprain, classic, with an associated ruptured peroneus quartus tendon from the calcaneal attachment. It'll come down here and attach over here on the calcaneus. So that's it. Thank you very much.